Hello, future Rossies and pre-med explorers. This is Milena Garcia, your host for Ross University Checking the Pulse, a pre-med podcast. This is our mini podcast featuring facts and information about our medical program, insights from current students, and tips from practicing physicians. Each week, this podcast will be broken down in small episodes, focusing on one aspect of our program, also having guests talk about their own experiences as students and as doctors. There are many specialized fields that doctors can pursue after their internal medicine residency. In this episode, Dr. Roberto Swazo talks about his path to pulmonary and critical care. This specialized field focuses on patients suffering from injuries and diseases of the respiratory system, which includes the lungs, trachea, diaphragm, and other related structures. At the time of our conversation, Dr. Swazo was a second-year pulmonary and critical care fellow at Indiana University. He has since completed the fellowship and is now a cardiac intensivist and pulmonary hypertension specialist at Orlando Health. Welcome back, future Rossies. Thanks for joining us again. So this week, we're going to be talking about internal medicine. With me here today, Dr. Swazo. Thank you for joining us. Let's take a moment to have you introduce yourself.
How's it going, everyone? My name is Roberto Swazo. I'm a previous graduate from Ross University back in 2015. Seems like forever ago now. And I graduated from University of Arizona in Tucson from internal medicine, and stayed on for an extra year to be the chief resident for a year, focused on some education and whatnot, and then ended up going to Pulmonary and Critical Care Medicine Fellowship at Indiana University, which is where I currently am now in the middle of COVID. So it's been a fun year.
Let's start from the beginning. What is internal medicine?
Internal medicine is basically a really broad scope of medicine. What it really stands for is taking care of patients that are too sick to be home, too sick to go home from the emergency department, and require inpatient further workup, management, medicine, etc. So anyone that's sick enough to be admitted to the hospital are the ones that we generally take care of. So any adult above 18 up until the geriatric population and anything in and in between. So that's internal medicine in a nutshell, essentially.
Now, there are different pathways that you can take after internal medicine, right? Can you talk a little bit more about the different pathways?
Absolutely. So there's generally three basic pathways that you can go down once you finish your internal medicine residency. So internal medicine residency is 3 years. And once you finish, then you kind of decide on how you want to approach things. You can either stay as a primary care physician, which basically takes care of patients in the outpatient setting, or you can become what's called a hospitalist, which is basically full-time taking care of only inpatients. Nice shift work, meaning you're there from 7 a.m. to 7 p.m. You work for a week and you're off for a week, and you do that for the whole year, essentially. And then the third pathway, which is becoming more and more popular nowadays, is going into the subspecialty services, which basically means there's a whole lot of different specialties that people kind of go into from here, including cardiology, gastroenterology, hematology and oncology, rheumatology, infectious diseases. So basically any of the ologies that you can kind of focus on after internal medicine is what people tend to go down a lot of times for further subspecialty management or care. And I ended up choosing pulmonary and critical care medicine for mine.
Mm-hmm. Tell us a little bit more about that.
So pulmonary and critical care medicine is actually two different fellowships kind of combined into one. So you can choose to just do a 2-year pulmonary fellowship, which is basically going into everything and anything that involves the lungs. So you become a lung specialist, essentially. And then there's critical care medicine, which is also 2 years on its own, which is essentially you're focusing on those that are most critically ill, and you focus on running the intensive care unit. Pulmonary and critical care medicine fellowship is combining both of those. So instead of 2 years and 2 years, you can actually do them both combined into one, which is a 3-year fellowship. So it entails doing inpatient and outpatient pulmonary medicine. So your consult services in the hospital stay. You can do a pulmonary clinic as an outpatient, taking care of all those with COPD, emphysema, asthma, all sorts of lung diseases. And then you also have the other transition, which is the intensive care unit. So all that acuity and that involves in taking care of someone that's critically ill, kind of on death's door, so to say. And we ideally try to save their lives, right? So it's got a good balance of a little bit of both worlds. And that's why I kind of ended up choosing that.
And how competitive is it to get into this area?
Yeah, so nowadays there's really 4 big ones that are very competitive to get into, and those are kind of the most famous ones, so to say, which is cardiology, gastroenterology, hematology, oncology, and nowadays pulmonary and critical care medicine is becoming more and more competitive. So it's important to know if you're interested in a subspecialty from when you go into internal medicine residency. And the reason I say that is starting from the beginning, it's nice to kind of get your foot in the door, start networking, meeting some folks from that same field, going into some research areas, maybe creating some case reports and abstracts. And then that way you can kind of start building yourself as someone that's interested in this subspecialty. So when it comes time to apply, you've shown that you've kind of applied yourself for the last 2 or 3 years, and you're ready to kind of go into that field as a specialist. So it is more and more competitive, but at the end of the day, there's ways to prepare yourself for that competition and kind of be as optimized as you can, so to say.
Critical care and pulmonary care is at the forefront right now of medicine, right? How has it changed, or how has it been affected by COVID?
Little did I know that I'd be going into fellowship in the middle of a pandemic, right? So it was wild. It was a very trying year. Obviously, COVID can kind of do whatever it wants in the body, but
Mhm.
predominantly it affects the lungs, right? And being a pulmonary physician, a lung specialist, and those that get very, very sick end up coming to the intensive care unit. So this year has basically been fellowship on steroids, so to say. So it's been longer, harder, faster than anyone kind of anticipated. I think one thing that we realized going into this year is that relationships and teamwork and peer building is kind of the most important thing. We wouldn't have been able to get through this year without them. But the fellowship itself has been affected in the way that it's just been more difficult, more trying, I guess, so to say, more time invested. But at the end of the day, I've come away with more immense knowledge than I could have ever anticipated about this disease process. So it's been a blessing and a curse, kind of combined. But wouldn't have changed anything for the world. I think it was the right time, and I have great job security now because of it, so to say.
And please know we appreciate the work that you do. I'm sure you must be exhausted. Thanks for hanging in there, and thanks for doing what you do.
Absolutely. No, thank you guys.
How do you feel Ross prepared you to enter medicine in your subspecialty all the way to the top?
Well, I feel like Ross prepared me exceptionally well. And I don't mean that as a cliche. I'm here to advertise for Ross because I feel the need to. They gave me an opportunity to be here. But at the end of the day, they also prepared me exceptionally
Mhm,
well. I was at Ross before they developed a lot of different track programs to kind of stay in one hospital system for an extended period of time. And I think that has its advantages in a lot of ways. But prior to that, I was traveling to different hospital systems for each rotations essentially. And for that, I took it as a blessing because I was able to meet different people, see how different people do different things in medicine, network, see which hospitals I liked, which ones I didn't, and kind of create my own style, so to say.
mhm.
So when I was ready to apply for residency, and I think because of the preparation that I was given, I was able to match into my number one spot for residency. And I excelled from the beginning because that adaptability that Ross really instills in you and that perseverance that you kind of go into really lended itself to doing well in residency. And I have to say that I'm not the only Rossi that's been successful. There's endless amounts of us, and I think we have a really good reputation in our hospital system because of that.
You mentioned several keywords that personally I really like and I feel really represent who we are. Number one, the opportunity, adaptability, perseverance, grit, right? I think absolutely
Yes.
this will help the students be successful. What about any advice for our future Rossies? Anything that you want to share?
Absolutely. I think going into medicine, it's a lifelong commitment. We're in this for the long run. I graduated from college in 2011, and 10 years later, I'm still not done with my training. So it's definitely not a short term career. I think at the end of the day, if you love what you do and you're invested in it, it's all worth it. I think Ross is incredible because it gives a lot of people the opportunity to go into medicine, and from there, while they train you, it's really up to you to be as successful as you want to be, essentially. So keep that sense of grit, keep that sense of perseverance, that hard work ethic that Ross kind of instills in you, and you will be successful. It's just a matter of time, and it's a matter of committing yourself to that field. So I wish everyone the best, and I'm a success story because of it, and I'm more than willing to kind of reach out to those that have any more questions for me.
Well, thank you, Dr. Swazo. I appreciate your time. I appreciate your work and your dedication. Be safe. Stay warm in Indiana. Thank you for your time, and for everyone else watching us, thank you for joining us, and we will see you next week. Thank you for listening to Ross University Checking the Pulse, a pre-med podcast. This is Milena Garcia, your host. This podcast is made for you, so let me know what topics you want us to cover on future episodes. You can send me your comments, feedbacks, and requests to mgarcia@rossu.edu. Definitely follow us on Instagram, Twitter, and our YouTube channel at Ross Med School, or on Facebook. If you're listening to this podcast on iTunes, I am working my way to 5 stars, so remember to send me your comments and let me know your ideas. If you're on Spotify, remember to click on the follow button to get our future episodes. All right, see you future Rossies and Pre-Med Explorers next week.